Welcome to our video series on how to be a good doctor. Today is part one of a series on ECGs on interpretation, or if you are in the US, we call them EKGs. My name is Dr. Iresha Gunasinghe. I am a consultant cardiologist from California. My goal is to teach you to interpret a STAT ECG comprehensively and quickly, especially if you are in the ER with a patient who's unstable. Before we dive into that part, I really want to share with you who a good doctor is, in my opinion. Should be someone who's compassionate and caring, a good listener who's knowledgeable, a lifelong learner, and someone who remains humble. As you recall, when we see a patient, we first take a history. And if you take a good history, you should be able to make a diagnosis most of the time. Next, we do a physical exam, and then we order investigations or tests. ECG is one of those tests we may order. And the purpose of a test is to either confirm a diagnosis, establish a baseline, or for monitoring purposes. Before we start learning to read an ECG, there are some basic facts you need to know. The first one is lead placement. We have 4 limb leads, that is right arm, right leg, left leg. Next, we have 6 chest or precordial leads, which are named V1 to V6. Positioning them at the correct place is critical for a proper reading of an ECG. So, V1 should be placed on the 4th intercostal space on the right side of the sternum. V2, 4th intercostal space, left of the sternum. Next, we place V4, 5th intercostal space, mid-clavicular line. V5, 5th intercostal space, anterior axillary line. And V6 is 5th intercostal space in the mid-axillary line. After that, we place V3 in between V2 and V4. So this is what we will get. And if you look at a ECG, this is where the limb leads are recorded, and they are marked 1, 2, 3, AVR, AVL, and AVF. And on this side, you get the chest leads, V1, V2, V3, V4, V5, V6. And at the bottom, you get what's called a rhythm strip, and usually that is lead 2, because normally lead 2 shows the P wave best. Now let's understand what these limb leads do. They are actually looking at the heart in the vertical plane. I want you to imagine if they are like detectives that we have placed in different parts of the body, and they are all looking at the heart. So if there's a detective here at lead 1, if a electric current comes towards that detective, you will see an upward deflection. If the current is going away from the detective, you will see a negative deflection. So here are positive deflections and you see negative deflections. The V leads are looking at the horizontal plane. It's like we cut the person. And this is what you will see. Again, there are 6 detectives. V1 and V2 are looking at the septum. V3 and V4 are looking at the anterior wall. And V5 and V6 are looking at the lateral wall. Next, let's look at the conduction system. As you know, the heart is like a four-roomed house. This is the right atrium, left atrium, right ventricle, and left ventricle. The SA node is found in the right atrium, and that's where the beats are. The heartbeat is originate. That's where it originates. And from there, it goes to the AV node. And from the AV node, through the bundle of His, divides into two, the right bundle and the left bundle. Now, the left bundle has two parts, which is the anterior division and the left posterior division. Once again, SA node, AV node, bundle of His, right bundle and left bundle. Now, let's look at the waveforms themselves. They have names. The first little upward deflection is called a P wave. Then there is a isometric area, and then you get a downward deflection. The first downward deflection is called the Q. First upward is called the R, and the one after that is called the S wave. And then where the S wave ends is called the J point. And then you have the T wave. So P, Q, R, S, and T. Next, there are a few intervals that we measure. The first one is the PR interval that starts from the beginning of the P to the beginning of the Q. Then from the beginning of the Q to the end of the T is the QT interval. Next, we have a PR segment, which is end of the P to the beginning of the Q. And then the ST is from the end of the S to the beginning of the T. And then, of course, you have the QRS complex. So now let's look at these in a real ECG. So remember, the best lead to look at all this is lead 2. So this little blip here, that's the P wave. And then this is the PR interval. Then this is the tiny little Q wave, which you can barely see. And then the upward deflection is the R. There is no S on this QRS complex. And then you have the ST segment and then the T. Now, let's look at lead V1. Again, you see the little blip, that's the P, and then this would be the PR, and then the first upward is an R, and then down after that would be the S, and next you have the T. Now, this is V1, and I want you to pay attention to this tiny little R. Look what happens to that as you get to V2. It becomes a little bigger. V3, it's even taller. V4, V5, V6, by the time it gets to V6, it's quite tall. So starting like this, the R became very tall, and that is a pattern that is normal, and you need to know about that. Next, let's look at the ECG graph itself. The first thing you have to pay attention to is the calibration. Is it calibrated properly? So you should check on that, and usually it will be like 2 squares up. One little square is equivalent to 0.20 seconds, which means 5 of them will be equivalent to 1 second. 15, that is 3 times 5, would be equivalent to 3 seconds. And just like that, 6 seconds will be 30 of these squares. And if you look within one of these squares, you see that they too have even smaller squares inside. So the tiniest square is 0.4 seconds. So that's the time scale. And on this side, one tiny little square is 1 millimeter. Therefore, one big square would be 5 millimeters, and 2 of them would be 10 millimeters. Now we are ready to start reading the ECG. Two principles that you have to remember. One, always be methodical and follow the same sequence. I cannot stress this enough. You have to follow this sequence. That is critical. The second is you have to practice and practice and practice. So if you ever see a EKG, grab it and quickly follow this sequence. So the first thing you check is the rate. There are many methods of checking the rate, and this is the easiest, and this is the one that I follow. So you find a nice QRS complex, and then you find the one next to that. After that, you start counting the number of squares. Okay, so if there is only one square between two QRS complexes, the heart rate would be 300. If it was 2 squares, that will be 150. 3 squares, 100. 4 squares, 75. 5 squares, the heart rate will be 60 beats per minute, and 6 squares will be 50 beats per minute. Okay, and it's best to memorize this. So it's 300, 150, 100, 75, 60, 50. So what you do is you find the first QRS and you start saying to yourself 300, 150, 100, 75, 60. So the heart rate here is 60 beats per minute. Okay. Now, 3 things can happen to the heart rate. One, it can be normal, or it could be fast. Fast is called tachycardia, or it can be slow, which is called bradycardia. So the definition of a tachycardia is if the heart rate is over 100 beats per minute, and that's 3 squares, right? So if you get a heart rate that is less than 3 squares, that is a tachycardia. Now, the definition of a bradycardia is if it is less than 60 or 5 squares. So if you get more than 5 squares, that heart rate is slow, and or we call it a bradycardia. So the normal is about 4 squares. This is a normal heart rate. The next, after we determine the rate, we go on to check the rhythm. At this time, I just want you to look at just 2 things. Is the rhythm regular or is it irregular? Okay, so how do we decide that? We start looking at the QRS complexes and see whether the spacing between each one is the same. And if it is, that's a regular rhythm. Now compare this one to this. You see that this one has 5 squares, this one has 3, 2, and then again 3. So this is very irregular. Okay, so we say this is a regular rhythm and this is a irregular rhythm. We'll learn more later on this subject. Now I need you to go back to the rate for one moment. Remember our method of memorizing and just calculating the rate? This works only if the heart rate is regular. If it is not regular, we have to use a different system. And that system is we count 6 seconds, and that will be equivalent to 30 squares, right? And then we see how many QRS complexes fit in that rhythm strip. So here is a 6-second interval, and we count 1, 2, 3, 4, 5, 6, 7. So there is 7 QRS complexes, and you multiply that by 10. Okay, so 6 seconds times 10 would be 60 seconds. So that's how many QRS complexes are there in 60 seconds or 1 minute. That is how you calculate the heart rate if the rhythm is irregular. So now we know how to determine the rate, and then we decided on the rhythm. The third thing we have to check on is the axis. Now an axis could be normal, or there could be left axis deviation or right axis deviation. Now what does this mean? If you look at a heart in cross-section, you will notice that the left ventricle has the largest muscle mass, right? So the current that is generated by the left ventricle is more than the rest of the heart in a normal heart. So, and majority of the current is going this way. And that's what we call the electrical axis. And it's normally around 60. But there is a range. Could be from minus 30 to 90. And that is considered normal. So minus 30 to 90 is considered normal. Anything beyond that towards the left side is called left axis deviation, and to the right is called right axis deviation. Now, this is a typo. This should be limb leads. And the way we decide on the axis is by using the limb leads. As I said, there are many techniques. Again, this is the one that I use, and it is really quick, and that's what we need. So we use lead 1, 2, and 3. Okay, that's all we use. Lead 1, 2, and 3. So if the QRS complex is upright in lead 1, 2, and 3, so it's up, 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 is a normal axis. Okay, so this is an real life ECG. So you look at up, 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 and you say the axis is normal. In a left axis, if you look at the heart, it's going towards the lead 1. Okay, so in lead 1, it's going to be up, but it's going away from lead 2 and 3. So the net QRS would be downward in lead 2 and 3. So if you get up, down, down pattern like here, that is a left axis deviation. Again, up, down, down. Okay. Then the same way, a right axis deviation, the electricity is flowing towards the inferior part of the heart, which is lead 3 and 2. So they are going to have positive deflections. And then since it's going away from the lead 1, it's going to have a negative deflection. So you are going to get a down, up, up pattern in right axis deviation. Want to teach you one more thing. What causes right axis deviation? There's many causes, but this is an easy one you can remember. The main reason for the electrical axis to be this way is because the bulk of the heart muscle is found in the left ventricle. If for some disease condition, the right ventricle became really thick and muscular, what will happen? The axis would move to the right, so causing a right axis deviation. So one of the causes of a right axis deviation would be right ventricular hypertrophy. Now, left axis is slightly different. Now, remember after the bundle of his, you get the right bundle and the left bundle. But the left bundle has two parts, left anterior division and a posterior division. Commonly, this left anterior division stops working. And if that happens, the posterior division has to do most of the work. And therefore, the axis deviates to the left side. Okay, so left axis deviation, one of the commonest causes of that is a left anterior hemiblock. Again, left anterior hemiblock. There are many other causes, but this is an easy one you can remember. So now we know about the rate, rhythm, axis. In the next video, we will talk about the P wave, the PR interval, and the QRS complex. I hope that you will be a wonderful doctor one day and help people in need without expecting anything in return. And I sincerely wish you the very best. And thank you for listening. Please do share this with your friends too.